Well, in this week's Cardiology Countdown, we have several small studies that look at important questions of timing of cath, as well as what's the optimal way to lose weight with patients with sleep apnea. So beginning with the first study from the Italian elderly ACS trial group, they studied the question of an early invasive versus early conservative strategy in elderly patients, those older than age 75, who present with a non-ST elevation acute coronary syndrome, and found there was just a non-significant trend in their 300-patient study, but favoring an early invasive strategy. They found about a 20% lower risk of cardiovascular outcomes. And in a pre-specified analysis found that the significant benefit was seen in troponin-positive elderly ACS patients with a 57% reduction in the primary endpoint, a significant interaction. Of note, the results are almost identical to what was seen in a broader population in the earlier Tactics TIMI 18 trial that I was involved with, where we also had pre-specified as a primary goal this notion of a greater benefit in troponin-positive patients. And so now consistent results in an elderly population. Next up, we have a study of 60 patients with obstructive sleep apnea and obesity, looking at two different modes of weight loss, either a standard low-calorie diet or that plus laparoscopic gastric banding as a way of doing bariatric surgery. The latter was more effective in helping patients lose weight, where they lost 27.8 kilos as opposed to 5 kilos with the diet. But interestingly, there was a non-significant improvement in obstructive sleep apnea. They found that there were 14 as compared with 25.5 episodes per hour of obstructive sleep apnea. They had planned to see a 50% reduction and actually saw nearly that, but the event rates were a little bit lower, and so this was a non-significant difference. So interestingly, not a definitive trial, but suggestive that perhaps bariatric surgery may be a better way of losing weight and improving obstructive sleep apnea, but again, non-significant trends there. The number one pick this week is a presidential consensus amongst the major cardiac societies, the ACC, AHA, ESC, World Heart Foundation, all getting together to reaffirm targets for global heart health. And they picked out amongst the many targets 4 of the biggest contributing risk factors, and the leading one was not enough physical activity. And so they set out a goal of having that improve by a relative 10% in the prevalence of those who are not having adequate physical activity. Then similarly, they set a goal of a 30% reduction in tobacco smoking, a 30% reduction in patients or people who take too much salt intake in their diet, and then finally 25% reduction in patients with elevated blood pressure. There were also many targets for different risk factors such as cholesterol and diabetes. And then, interestingly, a whole list of ways that these would be monitored through national surveys and registries to monitor progress in achieving these goals. And so a roadmap for better heart health that hopefully will be on that path. So for this week's Cardiology Countdown, I'm Chris Cannon.